Succinylcholine and Octreotide are quite different in terms of their pharmacological properties and clinical uses. Here are 15 key differences between them. 1. Classification: succinylcholine, neuromuscular blocking agent, depolarizing type; octreotide, synthetic peptide analog of somatostatin. 2. Mechanism of action: succinylcholine acts as a depolarizing neuromuscular blocker by causing sustained depolarization of the motor end plate. Octreotide inhibits the secretion of multiple hormones by binding to somatostatin receptors. 3. Clinical uses: succinylcholine used to induce muscle relaxation during anesthesia or for intubation. Octreotide used to treat symptoms associated with certain hormonal disorders, e.g. acromegaly, carcinoid syndrome, and to manage acute variceal bleeding. 4. Duration of action: succinylcholine, short duration of action, minutes; octreotide, longer duration of action, hours to days depending on formulation. 5. Route of administration: succinylcholine, typically administered intravenously. Octreotide can be administered subcutaneously, intramuscularly, or intravenously. 6. Metabolism: succinylcholine, rapidly metabolized by plasma cholinesterase. Octreotide, metabolized in the liver and excreted in bile. 7. Side effects: succinylcholine can cause muscle pain, hyperkalemia, and malignant hyperthermia. Octreotide side effects include gastrointestinal disturbances, e.g. diarrhea, nausea, gallstones, and bradycardia. 8. Onset of action: succinylcholine, rapid onset of action within seconds. Octreotide, onset of action varies depending on the indication and route of administration. 9. Specific indications: succinylcholine, primarily used for rapid sequence intubation in emergency settings. Octreotide, used for specific conditions like esophageal variceal bleeding and to reduce tumor size in certain neuroendocrine tumors. 10. Receptor specificity: succinylcholine acts primarily on nicotinic acetylcholine receptors at the neuromuscular junction. Octreotide binds to somatostatin receptors, subtype 2 and others, inhibiting hormone secretion. 11. Pharmacokinetics: succinylcholine, short half-life due to rapid metabolism. Octreotide, longer half-life, allowing for sustained effects after administration. 12. Drug interactions: succinylcholine interacts with drugs affecting cholinesterase activity. Octreotide interacts with drugs that affect gastrointestinal motility and absorption. 13. Cost: succinylcholine, generally less expensive due to its shorter duration of action and simpler synthesis. Octreotide can be more expensive due to its specialized use and longer duration of action. 14. Monitoring: succinylcholine requires monitoring for potential adverse effects on muscle function and electrolyte balance. Octreotide monitoring may involve assessing hormonal levels and symptom management in endocrine disorders. 15. Regulatory status: succinylcholine, generally available as a standard medication in anesthesia and emergency medicine. Octreotide, available under prescription for specific indications related to hormone-related disorders. These differences highlight how each medication is tailored to specific clinical needs and conditions, emphasizing the importance of proper diagnosis and treatment planning. Thank you.